Hello again, I'm Jay Noricks and the developer of Parts and Memory Therapy. This is our second video as we continue to introduce you to how parts and memory therapy works. I'm doing this introduction by linking what I share with you, as you'll see, the 20 months of therapy I did with a patient I'm calling Amelia. That therapy is chronicled in my book, Healing Amelia. The idea of parts of the self and how the self is not a unitary thing is the subject of our talk today. Instead, each of us is an amalgam of parts, variously called by other labels such as ego states, voices, subpersonalities, sides, and more. The earliest academic reference that I found in English to the universality of such parts comes from a paper published in 1926 by Morton Prince, one of the founders of American psychology, and he called parts sides, as in sides of the personality. My point is that the concept of parts is not a new one, and it's been acknowledged within psychology, especially in psychotherapy, for close to 100 years. But the theory of self and part that I'm introducing here is new. And for this discussion, I'm going to call the person talking to you now the conscious self. That's me. And my conscious self is talking to you over there. The conscious self that you would think of as me. And the content of the conscious self, as I'm defining it, consists of the core self plus other parts of the self. The core self represents pure awareness. That's an important concept. And because it's pure, it has no plans, no preferences, no existential goals. It just is aware. Remember that it is pure awareness, so there's nothing else there except awareness. So it must acquire other traits elsewhere, and that elsewhere is from parts of the self. The core self plus parts of the self make up the conscious self. Individual parts probably average about 8 to 15 in the minds or the personalities that make up the average person. We are quite capable of developing many more parts, depending upon how stressful or traumatic our lives play out for us. Some examples of parts we all have are angry parts, sexual parts, and romantic parts. And then there are other parts that are like teacher parts or carpenter parts or a manager part. They vary according to our individual careers. And then there are other emotional parts as well, sadness and fear and so on, as in the movie you may have seen, Disney's movie called Inside Out. Each of us develops our own parts as we adapt to the challenges we face. Speaking of challenges, here is a drawing of the Amelia part that she called Postpartum Me. It appeared in her life about 5 years before we met as a result of her postpartum depression. The depression she fell into, a real challenge, following the birth of her first child, her daughter. She also experienced postpartum depression following the birth of her son about 2 years later. And it's possible, even likely, that she never recovered from her first depression before having the baby and the second child and falling into her second depression. Her continuing depression was the reason she came to see me in the first place. She had taken one of my workshops when she signed on, and consequently she already knew about parts of the self. And when she began to describe her depression, I asked her if she could visualize the depressed part of herself. The drawing behind me was her response to my question. She visualized herself crying, feeling hopeless, lying on the floor of the shower, as the water sprayed over her. Interestingly, she has actually no recollection of ever crying on the floor of the shower. Instead, the image here is a symbolic one, and images of parts are always to some extent symbolic. The image that I have for my own angry part is also symbolic. It looks like the creature called the Thing, that orange made of boulders, one of the Fantastic Four of comic book fame. In case you wonder whether your own parts look like fantasy characters, the answer is maybe, but probably not. The majority of us have images of our own parts that look very much like what we look like when we look in the mirror, altered somewhat according to our different ages and attitudes that we subscribe to those parts. Over 20 years of doing parts and memory therapy, I found that about 10% of my patients, unfortunately, are unable to visualize the parts of themselves. For Amelia's parts, I commissioned an artist to draw them, based upon the descriptions that I passed along to the artist from what Amelia shared with me. A few of Amelia's parts look like what she might see in a mirror, but most do not. For example, Old Woman on the screen behind me is the part of Amelia that feels old and decrepit and exhausted, especially during the PMS phase of her menstrual cycle. And the birth of Amelia's daughter, plus her postpartum depression, appear to be the challenges that brought postpartum me, though, into existence. Part of that depression is shared, of course, with Old Woman. Our parts are not present at our births. They develop out of a need to face life's challenges. Their creation is automatic as we experience novel high-energy events. Their function is to ensure our safety as we face life's challenges. Their job description also includes, though, the maintenance of the memories that are the foundation for the way a part influences the whole person. These memories are the focus of our therapy. And in the next video, I'll show you the link between these memories and the cutting-edge neuroscience procedure called memory reconsolidation. Have a good day.